So, Lori, thank you very much for allowing this video recording and accepting it. I'm Dr. Armin Tehrany. This is for the audience and my friends and colleagues. Lori is kind enough to tell you in her own words what's transpired between the two of us. So she's my patient and she's going to have surgery. There's different types of surgery these days. There's elective surgery or there's non-elective surgery. Non-elective means something where we decide because of a tear of some type, and in this case it's the shoulder or the knee, that should have surgery done sooner rather than later because delaying the surgery has more likely of creating a negative outcome. So I spoke to Lori about not only that, but also any risks and benefits of contracting COVID. And there's a difference between us going to a hospital where unfortunately coronavirus is being treated, and so there's a risk, versus our ambulatory surgery center, which is freestanding, clean, and the risks are super low. I'm not God, I can't promise it, but we make sure everyone there is gloves and masks and they're symptom free. And so I had a separate conversation, Lori, with you, right, the other day to
Monday, yeah.
discuss these risks and benefits and whether we should proceed. And we decided together that it's a good idea to proceed tomorrow. So my question just is if you can tell the audience about how I made the separate call, we talked about the risks and benefits, you understand the precautions that we're taking, and that it's probably a good idea for other surgeons to have these separate conversations with the patients about COVID and the use of surgery centers versus hospital.
Right. No, I feel very confident, especially after speaking with you about it. I just know that, you're not letting anybody in. Everybody has to be checked. My husband can't even come in with me.
Nope.
He has to sit in the waiting room with a mask and gloves on.
Yep.
So I feel very confident about that. I just know that it's a surgery center is clean. It has to be cleaned every time, every day. I'm assuming I don't even know how many hours in a day it has to be cleaned. No one is in there that shouldn't be in there. It does.
Right.
You don't take care of other patients except for us.
Right.
I mean, I feel more confident too. I am the first patient,
Good.
so that gives you a little bit of an ease. Not that I'm saying that every patient after that should be upset about it, but
Sure.
I do know that you guys are going to wear masks, gloves. The way you took care of me the first time was
Oh,
amazing.
thank you.
It was just there's not much you can say about it except I feel very, very confident. And it is a surgery center versus the hospital. I have spoke to my family. I know I expressed that to you. They had a little concern, but I told them I feel very confident in what's going to happen. A lot of people are telling me don't do it,
Right.
but it's a surgery center, so
That's
that's
right.
why I feel a lot better about it.
Thank you.
I
I
don't
think this will be very helpful to
right,
the audience
right,
because we want people to be comfortable and understand there is a difference between going to the hospital to have surgery and going
right.
to an freestanding ambulatory surgery center, which doesn't allow coronavirus patients. They can't come.
I did also express to you and to the girls that have been calling me every day with the appointments and everything else that needs to be done. I just want to make sure that it's okay with you, that I'm not putting any of you at risk. But you're
Right.
all home, you're all working from home,
Yeah.
and there's, I mean, what else you could do about that?
Right. None of us who work at the surgery center want to get coronavirus either.
Right,
So we're all doing everything we can to help each other.
right,
And by the way, that includes the physical therapy afterwards. I've spoken with all the CEOs of the physical therapy establishments to ensure that they're not only open, but safe and keeping social distance between and among the patients to keep the risk as low as possible. And
right.
they've all assured me and promised me that that'll be the case.
I call them also just to make sure, the one that I go to, and she said the same thing. And they're clean to begin with. They clean off the tables every time you get off. So, you have to just keep washing your hands like I've been doing and just take care of yourself in that respect also. So
Thanks so much for your honest opinion. And
I hope all this helps. I really, really
it
do. And
will. It will. We'll get through this together. No question.
I hope so. I hope so.
All right. Thanks again. I'll see
Thank
you
you.
tomorrow.
I'll see you tomorrow. Thank you so much. Take care.